Have you ever woken up in the morning and felt just a little off, maybe a bit lightheaded or strangely tired even after a full night of sleep? A patient of mine once shared that she felt perfectly fine at bedtime, but when she opened her eyes the next morning, she felt a wave of dizziness that made her sit still for several minutes. And I want you to imagine this for a moment. What if the first few minutes after waking are far more important to your brain and heart than anyone has ever told you? Strokes happening right after waking are much more common than most people realize. Many seniors feel completely normal at night, but wake up with headaches, weakness, or a moment of confusion they brush off as aging. Doctors often talk about cholesterol and long-term risk factors, but very few take the time to explain why morning is one of the most vulnerable moments of the day. When your body shifts from deep rest to wakefulness, several powerful changes happen inside you. Your blood pressure rises sharply as your heart and blood vessels respond to movement. Circulation changes quickly as your body tries to redirect blood from resting mode to active mode. Your vessels tighten, your heart beats faster, and your brain needs more oxygen in a very short period of time. These transitions are normal, but they become riskier with age. Seniors face higher morning stroke risk because their blood vessels are more fragile, their circulation is slower, and their bodies are often dehydrated after hours without water. Medications taken at night can shift blood pressure too much by morning. Sleep disorders interrupt oxygen flow. And poor bedtime habits, like heavy meals or late-night stress, add even more pressure on the heart. From my years in practice, I've seen how this plays out. I've met seniors who felt just a little strange after waking, only to discover those sensations were early warning signs. It wasn't fear they needed, it was understanding. Simple science explains it clearly. Cortisol surges in the morning, blood becomes thicker overnight, and the sympathetic nervous system activates instantly when you stand up. In Part 2, we'll explore exactly what happens inside your body during this morning transition, which warning signs you should never ignore, and the daily habits that quietly increase stroke risk without being recognized. Stay with me, because what you learn next could protect your mornings and your long-term health. Let's go a little deeper together. In Part 1, we opened the door to a powerful truth. Mornings are not just another part of the day for your body. They are a transition, a shift, a moment when many invisible changes happen all at once. Now I want to walk you gently through what is really going on inside you after you wake up, so you can understand why this time is so important and how to protect yourself. Morning physiology. What happens inside the body after you wake? Imagine your body at night like a quiet house with the lights dimmed. Your heart is still working, your lungs are breathing, your brain is active in its own way. But everything is slowed, calmer, and in a kind of maintenance mode. Then morning arrives, and it is as if someone suddenly turns on all the lights, opens all the doors, and asks every system to get moving at once. One of the first changes is the morning cortisol spike. Cortisol is a hormone that helps you wake up and face the day. It rises naturally in the early hours to give you energy. The problem is that cortisol also raises blood pressure. For a younger body with flexible blood vessels, this surge is usually tolerated well. For an older body with stiffened arteries, that spike becomes more dangerous. As cortisol rises, the sympathetic nervous system also kicks in. That is the part of your nervous system responsible for the fight or flight response. Heart rate increases. Blood vessels tighten. Blood is redirected from the organs of rest, like the digestive system, toward the muscles and brain so you can stand, walk, and think clearly. This shift happens quickly, and speed is exactly what makes it risky for seniors. During the night, most people drink nothing for 6 to 8 hours. That means the blood loses some of its fluid content and becomes thicker. Thicker blood moves more slowly and is more likely to clot. When you suddenly ask that thicker blood to move faster through narrowed vessels under higher pressure, you create a situation where weak spots in the circulation can fail. When you stand up out of bed, your heart has to push blood upward against gravity. The heart rate rises rapidly to keep blood flowing to the brain. In a strong, young system, This adjustment is almost invisible. In an older system, blood pressure can dip suddenly and then rebound too high. The vessels may already be tightened from the night and from long-term aging. This makes the early morning hours, especially the first hour after waking, a time of intense like a neighborhood of pipes. At night, the flow is low and steady. In the morning, every faucet is turned on at once. If the pipes are old, stiff, or narrowed, that sudden rush creates a lot of strain. Understanding this is the first step in seeing why stroke risk rises when you open your eyes and start your day. Why strokes are more likely in the morning. Now that we have an idea of what is happening inside the body, let us talk about why it matters so much for stroke risk. Studies have shown that blood pressure can jump by 20 to 40 points within minutes of waking up. That is a huge shift for delicate vessels in the brain. Imagine an old garden hose suddenly blasted at full pressure. Any weak spot will be tested. This sharp rise in blood pressure puts stress on vessel walls that may already be thinned, hardened, or lined with plaque. If a vessel wall is fragile enough, that pressure can cause it to tear or rupture, leading to a hemorrhagic stroke. Even if it does not rupture, the increased pressure can disturb plaque that has been sitting quietly for years on the inside of the artery. A small piece of plaque breaking off and traveling to a smaller vessel in the brain can create a blockage within seconds. Sudden movement right after waking plays a role as well. Many seniors swing their legs out of bed quickly, stand up fast, and start walking right away. That quick transition forces the heart to respond suddenly. For some people, it can cause arrhythmias, changes in heart rhythm that lead to clots forming inside the heart. If that clot travels to the brain, a stroke can occur without warning. Stiff blood vessels behave differently than flexible ones. When vessels are stiff, they cannot expand and soften the force of each heartbeat. Instead, every surge of blood hits the vessel wall more directly. Morning pressure surges become like repeated blows against already stressed tissue. Slow circulation also increases clot formation risk. Thick, sluggish blood, combined with long periods of lying still at night, creates conditions where small clots can form in the legs or within narrowed vessels. When you get up and start moving, those clots can be pushed into circulation. Most cause no noticeable damage, but if one reaches the brain, the results can be life-changing. I have had patients tell me about brief episodes in the morning when their vision went dark in one eye, or their hand felt numb, or their words would not come out right for a few minutes. These events are often transient ischemic attacks, sometimes called mini-strokes. They are warnings, moments when the brain briefly loses blood flow and then recovers. They usually do not happen at random. Often, they appear in the morning when all these internal changes are happening at once. The point is not to scare you, it is to uncover a truth that can empower you. When you understand why mornings are risky, you can learn to move through them more gently, more consciously, and with more protection. Hidden morning stroke triggers most seniors ignore. Let us talk about the things most people never think about, the quiet habits that make mornings even riskier. One of the most common is getting out of bed too quickly. Many seniors swing their legs to the side and stand in one smooth motion. They do it because they have always done it that way. But for an older body, that quick transition can cause blood pressure to drop and then rebound suddenly. The brain may not get enough blood for a moment, leading to dizziness, and then the vessels tighten to compensate, creating extra pressure on the system. Skipping morning hydration is another hidden trigger. Remember how blood gets thicker overnight. When you move from lying down to standing without drinking any water, you are asking that thicker blood to circulate under stress. A simple glass of water before you stand can soften that transition by adding fluid back into the bloodstream. Room temperature also matters. Sleeping in a very cold environment can cause blood vessels to constrict. When you get out of bed into cold air and start moving, those narrowed vessels are suddenly faced with higher pressure. On the other hand, a room that is too warm can cause dehydration and pressure changes of its own. Balance and stability are key. Nighttime bathroom trips are another overlooked factor. Many seniors wake up during the night to use the restroom. They are half asleep, the room might be dim, and they often stand up too quickly. If they feel dizzy, they may grab a wall or rush to sit down, but the circulation has already been disrupted. That moment of imbalance, combined with sudden shifts in pressure, can be dangerous. Holding your breath while stretching is a quiet morning habit that few people notice. Many seniors naturally hold their breath when they reach or lean down to pick something up. Breath holding raises pressure inside the chest and head. In the morning, when blood pressure is already climbing, this extra push can be harmful. What you ate the night before also plays a role. High-sodium dinners cause the body to retain fluid and raise blood pressure overnight and into the morning. Poor sleep quality, whether from worry, pain, or sleep disorders, means your body does not get restorative rest. Stress hormones remain elevated, and vessels do not relax the way they should. Each of these triggers might seem small on its own, but together they create an environment where stroke risk grows quietly. Recognizing them is not about blaming yourself. It is about seeing the full picture of how your habits, your environment, and your internal physiology come together each morning. Hidden morning stroke triggers most seniors ignore. Let us talk about the things most people never think about, the quiet habits that make mornings even riskier. One of the most common is getting out of bed too quickly. Many seniors swing their legs to the side and stand in one smooth motion. They do it because they have always done it that way. But for an older body, that quick transition can cause blood pressure to drop and then rebound suddenly. The brain may not get enough blood for a moment, leading to dizziness, and then the vessels tighten to compensate, creating extra pressure on the system. Skipping morning hydration is another hidden trigger. Remember how blood gets thicker overnight. When you move from lying down to standing without drinking any water, you are asking that thicker blood to circulate under stress. A simple glass of water before you stand can soften that transition by adding fluid back into the bloodstream. Room temperature also matters. Sleeping in a very cold environment can cause blood vessels to constrict. When you get out of bed into cold air and start moving, those narrowed vessels are suddenly faced with higher pressure. On the other hand, a room that is too warm can cause dehydration and pressure changes of its own. Balance and stability are key. Nighttime bathroom trips are another overlooked factor. Many seniors wake up during the night to use the restroom. They are half asleep, the room might be dim, and they often stand up too quickly. If they feel dizzy, they may grab a wall or rush to sit down, but the circulation has already been disrupted. That moment of imbalance, combined with sudden shifts in pressure, can be dangerous. Holding your breath while stretching is a quiet morning habit that few people notice. Many seniors naturally hold their breath when they reach or lean down to pick something up. Breath holding raises pressure inside the chest and head. In the morning, when blood pressure is already climbing, this extra push can be harmful. What you ate the night before also plays a role. High-sodium dinners cause the body to retain fluid and raise blood pressure overnight and into the morning. Poor sleep quality, whether from worry, pain, or sleep disorders, means your body does not get restorative rest. Stress hormones remain elevated, and vessels do not relax the way they should. Each of these triggers might seem small on its own, but together they create an environment where stroke risk grows quietly. Recognizing them is not about blaming yourself. It is about seeing the full picture of how your habits, your environment, and your internal physiology come together each morning. Warning signs. After waking up, that should never be ignored. Now, I want to talk about something very important. The body is not silent. It sends messages, especially in the morning. The challenge is that many of those messages are subtle, and because they pass quickly, people dismiss them. I want you to hear this clearly. Some symptoms after waking should never be ignored. If you wake up and notice temporary vision loss, even for a few seconds, that is not just tired eyes. It can be a sign that blood flow to the visual parts of your brain was disrupted. If you feel sudden dizziness, as if the room is spinning or your body is unstable, that may reflect a brief drop in brain blood flow. If your limbs feel numb or weak on one side, even if the sensation improves after a few minutes, that is a red flag. A sudden headache in the morning, especially one unlike your usual headaches, can be a warning sign. Chest pressure or shortness of breath after standing or walking a few steps also deserves immediate attention. Confusion, difficulty speaking, or trouble finding words are especially serious. These can all be signs that the brain is not getting the blood or oxygen it needs. Many seniors tell themselves they will wait it out and see if it gets better. They do not want to bother anyone. They do not want to feel dramatic. But time is everything when it comes to stroke. Waiting can mean the difference between a minor event and a life-changing disability. If these symptoms appear, even if they fade, they are your body's way of calling for help. You are not being a burden by responding. You are honoring your life and your future. I always tell my patients, I would rather you seek help 10 times and have it be nothing serious than stay home once when it truly matters. Listening to your body in the morning is one of the most powerful forms of self-protection you have. How to lower morning stroke risk with simple daily habits. The good news in all of this is that you are not powerless. There are simple, gentle habits you can use every single morning to lower your risk and support your brain and heart. One of the easiest is to drink a glass of water before you stand up. Keep it by your bedside. When you wake, sit up slowly, take a few breaths, and sip your water. This helps thin the blood slightly and supports smoother circulation before you ask your body to move. Next, give yourself a pause. Sit on the edge of the bed for about a minute. Let your nervous system catch up. Feel your feet on the floor. Notice your breathing. This short pause allows your heart and blood vessels to adjust gradually instead of being pushed into instant action. Gentle stretching before walking helps too. Simple movements like rolling your ankles, lifting your calves a little, or shrugging your shoulders can ease stiffness and encourage blood flow without strain. Think of it as warming up an engine before driving. Keeping your bedroom at a stable, comfortable temperature protects your vessels from sudden constriction or dilation. Avoid extremes of heat or cold whenever possible. Choosing bedding that keeps you neither too hot nor too chilled can make a real difference. Avoid rushing in the morning. Build in a few extra minutes so you do not feel forced to move faster than your body can safely handle. Move with intention rather than urgency. Checking your blood pressure regularly, especially if you have a history of hypertension, is also a powerful habit. You do not need to check it every day, but a weekly routine, including occasional readings after waking, can reveal patterns that you and your physician can address together. Consistent sleep patterns help regulate your internal clock and hormone cycles. Going to bed and waking at similar times each day makes your body's transition smoother and less stressful. Each of these steps is small, but together they create a softer landing for your brain and heart every morning. They send a message to your body that you are on its side. Lifestyle and long-term strategies for stroke prevention. Finally, let us zoom out and look at the bigger picture. Morning routines matter. But your overall lifestyle is the foundation that supports everything else. An anti-inflammatory diet rich in fruits, vegetables, whole grains, healthy fats, and lean proteins helps keep blood vessels flexible and less prone to plaque buildup. Reducing processed foods and excess salt lowers long-term blood pressure and decreases the burden on your heart. Regular low-intensity exercise, like walking, gentle cycling, or swimming, improves circulation, strengthens the heart, and supports healthier vessel function. The key is consistency, not intensity. A little bit, most days, is more valuable than rare bursts of hard effort. Breathing practices, such as slow, deep breaths for a few minutes each day, can help calm the nervous system and reduce morning pressure spikes. These practices tell your body that it is safe, reducing the need for constant fight or flight responses. Managing nighttime stress is also essential. Calming routines before bed, like reading, prayer, soft music, or gentle stretching, help lower cortisol levels and prepare your brain and heart for true rest. When you sleep more peacefully, you wake more stable. Medication timing and consultation with your physician are another important component. Some medications may be better taken in the evening or morning depending on how they affect blood pressure and circulation. Regular check-ins ensure that your regimen supports, rather than complicates, your natural rhythms. Finally, staying socially connected helps lower cortisol and inflammation. Loneliness and chronic stress weigh heavily on the heart and vessels. Phone calls, community groups, family visits, and meaningful conversations all nourish your emotional health, which in turn supports your physical health. You are not at the mercy of your mornings. You have more influence over what happens in those early hours than you may have ever been told. With awareness, intention, and a few gentle changes, you can move through each morning with more safety, confidence, and peace. In the next part of this journey, we will bring all of these ideas together and close with a message of hope, gratitude, and encouragement so you can carry this knowledge forward with strength rather than fear. As we come to the end of this journey together, I want you to pause for a moment and truly honor the body you live in. This body has carried you through decades of mornings and nights. It has protected you, healed you, and adapted for you, even in times when you didn't realize it was working so hard in your favor. It deserves gentle care, especially during those first precious moments after you wake. When we understand what happens inside the body in the morning, something shifts. We stop living with fear and start living with awareness. Knowledge doesn't weigh us down, it lifts us. It gives us the confidence to move through each day with intention and steadiness. The morning is no longer a mystery. It becomes a place of opportunity. Every small choice you make in those early minutes matters more than you think. The water you sip before standing, the pause you allow yourself at the edge of your bed, the slow stretch you give your muscles, the breath you take before rushing into the day. These are not just habits, they are acts of self-respect, acts of self-protection, acts of love for the future you. And I want you to remember this. You are never alone on this journey. Senior Health Daily is here to walk with you, to guide you, to offer clarity when things feel confusing, and companionship when you need encouragement. Your mornings can be safer, calmer, and more empowering. You have the strength to shape them. Thank you for spending this time with me. I am grateful for your trust, your presence, and your commitment to your own well-being. Take care of yourself, be gentle in your mornings, and stay connected with Senior Health Daily so we can continue this path together.